Hello everyone, my name is Djamel Hamadache. I'm an independent pediatric and adolescent HIV nurse and also a member of the Children HIV Association Steering Committee. Today I'm going to present to you the COVID-19 and Young People survey, which was presented at the Chiva 14th Annual Conference this year. So why did we decide to undertake such survey? On the 30th of January 2020, the WHO declared COVID-19 pandemic a public health emergency of international concern. Subsequently, the Prime Minister Boris Johnson announced that the UK would enter a period of lockdown. Around the same time, NHS England and Improvement sent a briefing note to NHS Trust across the country requesting NHS services to redirect staff and resources, and they also published guidance on COVID-19 redeployment. As a result, Chiva decided to develop support services to offset the impact of lockdown and the reduction in services on families and more specifically children and young people living with HIV. By July 2020, a survey was sent to young people known to Chiva or their parents, if under 13, so they could share that with their young people. As you can see, Chiva has been rather busy with updating their guidance and web pages, as well as engaging young people in creative activities like Art is Key, the photo contest on young people experience of lockdown, as well as a virtual protest night in response to the Black Lives Matter movement. In addition, direct support included weekly Zoom sessions and one-to-one telephone calls. A hardship fund enabled families to access food and household essentials. And as you can see, these are some of the flyers used to recruit participants. And also there were some virtual yoga sessions. And these are some of the photos that were part of the photo contest. And as you can see from the last flyer, Chiva has planned some sessions up to the end of this year. So our objectives were to assess the potential change in health, social, and emotional needs of families, but more specifically young people growing up with HIV due to COVID-19 and the lockdown, to measure the impact and success of Chiva support services in supporting families, but also keeping young people up to date with information on COVID-19 and HIV. To identify unmet needs of young people living with HIV and to reflect on lessons learned and inform progress to more sustainable support services in case of subsequent restrictions. The key components of our methodology included a collaborative approach between Chiva Steering Committee and the MRC CTU. By using the Health Research Authority decision tool, we came to the conclusion that ethics approval was not required, considering young people were recruited directly by Chiva with no need for consent. We were able to collect quantitative and qualitative data. And it's worth mentioning that a separate BIVA, Chiva and Public Health England COVID survey was also used to assess the impact of COVID on pediatric HIV clinics, which was also presented at the Chiva conference. So we had a total of 31 young people who took part in the survey. And as you can see, participants responded from across the UK, with the highest number from London. Of the 31 participants, 2/3 identified as female, over half were aged 14 to 16 years old, and a third were 17 years and older. All participants lived with their family. Over half of the participants, 58%, reported that everyone in their home knew about their HIV status. A third said not everyone was aware, and 2 participants did not know. Of the 13 participants who said not everyone knew, all said at least one person in the house did. All participants had access to internet at home prior to lockdown. And 2/3 reported they had easy access and 16% pretty easy access. However, 90% of participants said their internet access was a little difficult. Although only 42% of respondents felt good about themselves, with a proportion similar to prior to lockdown, and less than half, 45% of participants reported that they enjoyed their time at home. Nearly two-thirds, 63%, enjoyed spending more time with their family. Although only half were still able to do things they like, nearly three-quarters, 71%, reported they had kept themselves busy with activities, and almost 80% were able to keep in touch with friends and continue with schoolwork and their job. With regards to their experience of lockdown and the impact on health and well-being, there was no significant change in the proportion who said they were not worried about money, 73% before lockdown compared to 63% during lockdown, or who were not worried about access to food, 97% before lockdown compared to 93% during lockdown. Younger participants were more likely to think that they stayed in good health. 89% of those aged 10 to 16 years old compared to 55% of those aged 17 years and older, or had managed their medication well. 90% of those aged 10 to 16 years old compared to 64% of those aged 17 plus. Overall, across both age groups, the proportion of participants who felt they managed their HIV medicine well before lockdown, 90%, was higher than during lockdown, 77%. About half of participants reported that they worried about COVID-19, and 90% reported knowing where to find information about COVID-19. Sadly, 10% of participants reported having lost someone from COVID-19. Young people were also asked to share their thoughts on their experience of lockdown. From the analysis of the qualitative data, here are three key themes that were identified, and I'm just going to present them one by one. So, mental health, well-being, and social support. Participants expressed increased anxiety and depression as a direct result of lockdown, and young people felt isolated from friends, with the lockdown disrupting access to social support. And as you can see, some of the quotes indeed support that statement. One participant described that their feeling of isolation came from a lack of access to both real life support and mental health support services. So my mental health got a lot worse due to mental health team not being available and the lack of access to real life support, which I rely on a lot. Another quote, for instance, it has kind of made me be a bit lonely because I don't get to see my friends physically, but at least I talk to them on the phone. So young people also reported that the lockdown impacted on their daily routine and activities, with a reduction in their freedom and independence, as illustrated by the green and pink quotes. Yes, I feel like everything I've been trying to do has been put on pause, or it affected me greatly because I was not allowed to go to school, and because of my HIV, my family never allowed me to go out. There were also mixed feelings expressed about keeping up with schoolwork, as illustrated with the two quotes. One person felt that he was able to take a break from school, rather than another one who expressed not being able to keep up with school. 4 participants describe ways in which the effect of COVID-19 and the lockdown had impacted their friendship, sense of self, and sense of place. They describe how isolation gave them time to reflect on their perception of self and social experiences, as illustrated with the two quotes. It made me think more about my importance to the people that care about me and showed me who my real true friends are and taught me responsibilities that will have to stay with me forever. Or another person who said it has helped me realize what I'm passionate about and it gave me time to focus on what I like. When asked how useful Chiva support services were, 80 to 90% of participants found each service very or somewhat useful. Young people were also asked about future services and how Chiva could better support them in another lockdown or restriction. Most common responses included more interactive and creative support services. For instance, with the purple quote, I'm not sure, maybe just Zoom again, but with more activities. It's hard to imagine how support would look in another lockdown, but maybe just checking in, which Chiva already does. And another quote, more art activities and HIV-related quizzes. Other responses included one-to-one support, but more specifically, direct and indirect mental health support, such as the quote, Chiva has done well so far, so I don't really know. Or they can make us aware of every event that is going on. So in summary, almost everyone had someone in their household who knew about their HIV. However, a significant number did not live in household where everyone knew. Young people appreciated more time spent with family and the ability to carry on with things they enjoyed. Mental health and well-being is particularly important to consider alongside the reduced access to support young people have experienced and how isolated they may have been from usual sources of support. Wider studies indicate young people may have experienced worse mental health impacts during lockdown than older people. Chiva is a trusted source of information for young people. Easy access is crucial, and also having the space to explore their understanding and ask questions. We need to better communicate information and where to access support. Finally, Chiva can consider how to reach the range of needs which the survey identifies. Information and social support needs can be effectively met through the online group sessions, which young people have appreciated. Some mental health support is also delivered here, continuing to provide more direct intervention, one-to-one support and connecting with clinic teams where more concerning mental health impacts are identified remains crucial. As you may anticipate, we had some limitations to the survey, including the small number of participants, and also all participants were known to Chiva, and the access was exclusively online. Therefore, those who did not have access to internet or even a device to be able to access the survey could not take part. Our next step are the writing of an interim and final report, hopefully including the findings of the BIVA Chiva PHE survey on the impact of COVID-19 on pediatric HIV clinics. We're also planning to hopefully do one-to-one interviews as well as focus group discussions if we do have sufficient funding and resources. And finally, we'd like to publish our findings and also disseminate via relevant journals, conferences, specialist professional bodies as well. So watch that space. Finally, I would like to thank my colleagues who contributed to this work, including those from the Chiva steering group, as well as colleagues at the MRC CTU. And a special thank you to all the young people who currently participated in this survey. Thank you very much for listening.